Hello everyone, welcome at SudhirEyeCoach, a channel for budding ophthalmologists. How can we handle a grade 4 nucleus safely through Phaco? Few tips and suggestions. As a normal routine case, I created 2 side port incision and filled the chamber with air, stained the antechamber with Tepon blue, and now fill the chamber with viscoelastics. Visco selections you can decide by yourself as per your choice. If you wish, you can use cohesive viscoelastics or a combination, or you can use methyl cellulose. Here in this case I used methyl cellulose. First step is to create a larger capsular axis because we need a larger room to handle the hard nucleus. And second tip is the use of rigorous viscoelastics to protect the corneal endothelium. So I created a larger capsular axis. Never hold the conjunctiva to stabilize the globe. Just simply putting iris repositor in the side port serves the purpose. Now time for gentle hydro procedures. Meticulous gentle hydro procedures is crucial. It reduces the traction on the zonules during nucleus manipulation. Before starting phacofragmentation, always use dispersive viscoelastics to coat the endothelium. And if you are beginner, do not hesitate to use copious dispersive viscoelastic between the phacofragmentation. Take some time to remove the anterior plate to expose the nucleus. In this case, I used divide and conquer technique. Here I created a trench. How can we decide this safe depth of a trench? Normally I keep the depth equal to the thickness of the tip. It means the depth is around 2.2 mm. Then I rotated the nucleus and now I am ready to create another trench. So this will create a 4 equal quadrants. Now it's a personal choice. You can split the nucleus by using 2 choppers, what we call bimanual technique. What I do, I use phaco tip to hold the quadrant, and with the chopper I try to split the fragments. Sometimes it is not easy to crack the nucleus in full thickness because of the leathery posterior plate. So the tip is here is that keep the patience and hold the nucleus chunk with the tip and try to split it in small pieces. Phaco settings are important here. Always you use less torsional power to get the proper hold. Keep on digging the bigger pieces, just grab it and split it with the chopper. Again hold it firmly and now divide it with the chopper. After splitting the nucleus in smaller pieces, now time to debulk it. Start from the center. Whenever you find a bigger piece, just keep patience, hold it and then chop it with the chopper and then try to pull it towards the center. In between you can stop, you can fill the antechamber with viscoelastics, coat the endothelium to protect it from the moving fragments. Never try to do emulsification at the periphery. Always drag it toward the center and then start the fragmentation. For holding, you need less torsional power, and for dissolving or for fragmentation, you need more torsional power. In this case, if you are not able to hold it at the periphery, then switch it in the chopping mode. Again hold it, pull it in the center, and then switch the phaco in the quadrant mode and do the fragmentation. You can see the nucleus is almost black. Now the plate is now divided and it has rotated. During the last piece of fragmentation, you have to be very cautious about the fluctuations on the posterior capsule. Although the modern machines, because they have ability to maintain excellent fluidices, normally it's difficult to catch the posterior capsule, but you have to be cautious and careful. Now time for visco removal. Again, the key is never try to aspirate the whole of the cortical matter in the periphery. Always catch hold the tip of the cortex and drag it toward the center and then try to aspirate it. There is no rocket science in this. Whatever fragmentation and whatever aspiration you're doing, you should do it under proper visualization in the center. Never try to do fragmentation and aspiration in the periphery. The patient was having large macular scar, and which is evident on the basis of color of the glow. Cortical aspiration should be done under proper visualization and care. Majority of the posterior capsular events happen at this time only. Now the eye is ready for the implantation. So tips to handle the black nucleus are: number 1, always try to create a larger capsular axis so that you will get a more playground to handle the fragments without touching the capsular axis and creating any capsular dehiscence. Second thing is use copious amount of dispersive viscoelastics to coat the endothelium so that you won't get corneal decompensation or loss of endothelium. Third is use divide and conquer technique, especially for the beginners. And fourth is keep patience. So your patience is very important here. You have to control your nerves. You have to be very diligent about handling the nucleus fragments. Every surgery is different, but when you prepare your mind, when you prepare your patient, keep your nerves under control, definitely you are going to win. If you have any comments and questions, please ask, and definitely I'll try to answer them. And thanks for watching.